My name is Simranjit Kaur. I'm an M3 from the University of Mississippi Medical Center, and I'm really excited to talk to you all about my project, which is titled Reduce Utero-placental Perfusion and Acute Seizure Exposure Induced Modest Learning Impairments, Alzheimer's Disease Markers, and Reduced Cerebrovascular Perfusion in mice at 2 months postpartum. But before I get into my PowerPoint, I just wanted to take a moment for us to just imagine a pregnant individual. Now, this person can be somebody in your clinic or somebody that you know personally, and they've been having a relatively normal pregnancy, but sometimes they have higher blood pressures, a little bit out of the normal. Sometimes they'll have a headache or some moments of shortness of breath, but they end up delivering and you assume everything is fine. But a few days later, their blood pressure starts to skyrocket. They're having very severe headaches and shortness of breath and vision changes, and even an episode of a seizure or two. And what I just described after that delivery period is something called postpartum eclampsia. But before we can talk about eclampsia, we need to understand a little bit more about preeclampsia. So preeclampsia is a hypertensive pregnancy disorder that's characterized by the new onset of hypertension after 20 weeks gestation. Mothers can have blood pressures higher than 140/90. It's one of the leading causes of maternal and fetal death worldwide, and it can affect a multitude of organ systems. And unfortunately, there's only a limited prevention and treatment available. Now, preeclampsia can progress into something more severe called eclampsia with the new onset of seizures. And it can have the same symptomology as preeclampsia, but you can also have an increased risk of cerebral hemorrhaging, and it can even progress into death. And eclampsia can occur at any point in your pregnancy. And the mechanism of how eclampsia occurs is still kind of unclear, but a proposed mechanism involves the fact that preeclampsia can cause alterations in your cerebral blood flow, causing an impaired cerebral autoregulation and causing a permeability to occur to your blood-brain barrier. You don't want your blood-brain barrier to be permeable, and so what I mean by cerebral autoregulation is just the homeostatic process that your brain undergoes to have adequate blood flow continuing at varying blood pressures. And since preeclampsia can cause that impaired cerebral autoregulation, you can have many complications after pregnancy. So during pregnancy, you can have neuronal damage or cerebrovascular injuries, but you can also have postpartum complications. So early postpartum, you can have vascular injury or neuroinflammation, but many years down the road, studies have seen women have, with severe preeclampsia, white matter lesions and cognitive impairments. They've also had vessel rupturing due to that increased blood pressure. And studies also support the idea that women with a history of severe preeclampsia or hypertensive pregnancy disorders can have an increased risk of long-term neurovascular abnormalities like vascular dementia. And a study done in about 2016 was able to see that a history of hypertensive pregnancy disorders like preeclampsia has been associated with an increased risk of mortality from Alzheimer's disease and stroke many years after their pregnancy. Now, the potential link between Alzheimer's disease and preeclampsia is not that well studied, but something that my lab was trying to propose is just looking at the pathogenesis of Alzheimer's disease. So one big aspect of Alzheimer's disease are those amyloid beta plaques that build up within the brain. And a study was able to see that that with mothers with a history of preeclampsia, that there was some toxic protein misfolding occurring where the amyloid beta precursor proteins were able to aggregate together in the placenta and in the plasma. And another aspect of Alzheimer's disease is part of the cerebral regulation or cerebral perfusion that occurs in the brain. People who have Alzheimer's disease have a decreased cerebral perfusion. And so that causes hypoxia or ischemia because you're not getting enough nutrients or oxygen to the brain, which then causes a decrease in the vascular densities that's supplying the brain, and in the end causing some cognitive dysfunction. All that to say brings me to my study where we wanted to see how the preclinical model of preeclampsia called RUP or reduced utero-placental perfusion, how that model can, if we expose it to seizures trying to mimic eclampsia, if it can, one, induce impaired learning and memory, two, reduce baseline cerebral perfusion, and three, increase Alzheimer's disease markers at 2 months postpartum. And just a little bit of an overview of my study design. After mating our mice, we were able to give them a surgical intervention. So the RUP procedure involves opening up our mothers, counting how many pups they have, ligating that uterine artery just to mimic the preeclamptic state, and then closing them back up. And then we had our shams, which served as our surgical control, where we just opened them up, counted how many pups they had, no ligating of the arteries, and closed them back up. On gestational day 18.5, we induced seizures again to mimic that more severe complication, eclampsia, and we did this using pentylene tetrazole, or PTZ. Later, they were allowed to deliver, and then 2 months postpartum, they underwent a cognitive functioning test to assess their learning and memory by using the Barnes maze. After that, we looked at their cerebral perfusion, where we took off their scalp to look at the superior arteries in the brain. And then after that, we harvested their brain tissue. And I'm just going to talk about the cortical data in this presentation. So looking at our learning and memory or cognitive function behavior testing, we assess many parameters, but the ones I'm going to talk about today are just the path length, which is the distance traveled within the maze that our mice took, and then the total errors made. So how many times they went to a hole that was not the target hole. And so what we saw was that our mice that were exposed to RUP during pregnancy had an increase in path length and an increased amount of total errors on day 1 of learning and memory. And this suggests some modest learning impairments occurring. But after the 4 days of learning and memory trials, all of our groups were able to know where the target hole was and taking less time or less distance to get there. And after the 4 days, we, on the 5th day, looked at their short-term memory, where we put them back into this context. And then we were able to see and count how many times they went to holes that were not the target hole. And what we were able to see was that our mice that are exposed to RUP during pregnancy looked at the target hole less compared to the other groups, which again suggests some modest learning impairments occurring. We also wanted to see what they were doing in the Barnes maze, so we looked at our heat map. We could see that all of them knew where the target hole was, suggested by the red color, but we were able to see our moms are exposed by RUP and exposed by seizures, and especially moms with RUP and seizures explore the maze more compared to the other groups. Next, we looked at their cerebral perfusion. And so we did this using a laser speckle imager to look at the superior arteries of the brain. And we have some representative images on the left, but in the red color signifies blood flow. But the regions of interest that we wanted to look at were the left and right parietal cortex, the prefrontal cortex, and the whole brain, just regions that were implicated with learning and memory. And what we found was that our moms that were exposed to RUP and exposed to seizures had a reduced baseline cerebral perfusion across the entire areas of their brain. So reduced in the left and right parietal cortex, in the prefrontal, and the whole brain. And just going back to something I said previously about the pathogenesis of Alzheimer's disease, that is something we see with people with Alzheimer's disease, that decreased cerebral perfusion. And we're seeing that with our mice that were exposed to that preeclamptic and eclamptic state. From there, we were able to harvest their brain tissue, and I'm just going to talk about the cortex today. And we saw that our mice that were exposed to seizures actually had an increase in the total tau and amyloid beta 42. So tau is one of the pathological hallmarks as well with Alzheimer's disease, and amyloid beta 42 is one of the more common isoforms that make up the amyloid beta plaques. And trying to connect how our data that we found from our cerebral perfusion and our amyloid beta 42 kind of like work together, we saw that as the amyloid beta 42 concentrations increased, we also had a decrease in cerebral perfusion, which goes back to just the pathogenesis and pathology of Alzheimer's disease. You have that increased plaque burden potentially causing some vascular changes and damaging to the vascularity of the brain, causing decreased cerebral perfusion. So in summary, we were able to see some modest learning impairments occurring following our RUP exposure, some increase in concentrations in our cortical tau and amyloid beta 42 is following seizure exposure, and reduced cerebral perfusion in our mice that are exposed to RUP and with seizures. And this was just a preliminary study that was done in our lab, but our results support the hypothesis that a history of preeclampsia or eclampsia-like symptoms was associated with modest learning impairments, cortical hyperperfusion, and increased Alzheimer's disease markers in the postpartum period. This is my works cited, and thank you so much for allowing me to talk today.